If you're not one to let pain slow you down, you've probably been taking these products for years. You may know them by their familiar names like aspirin, acetaminophen, naproxen, and ibuprofen. They are all over-the-counter analgesics. But here are some facts about them that can make you a smarter consumer. Analgesics are the most frequently used OTC medication. 1 in 5 Americans uses them at least weekly, and well over 80% have used them in the last year. But half of those who use them do so without reading their labels, and nearly half are unaware of the potential adverse effects associated with taking them concurrently with prescription drugs. There are 2 broad categories of over-the-counter pain relievers and fever reducers. One is acetaminophen. The other is non-steroidal anti-inflammatories, or NSAIDs. Acetaminophen are used to relieve headaches, muscle aches, and fever. It is also found in medicines like cough syrup and cold and sinus remedies. NSAIDs help relieve pain and reduce fever. They include aspirin, naproxen, and ibuprofen, and they are also in medicines taken for cold, sinus pressure, and allergies. Then there are topical analgesics. They are used for minor musculoskeletal injuries such as strains and sprains. They include camphor, menthol, methyl salicylate, and methyl nicotinate, among others. These products have local analgesic anesthetic and are counter-irritant effects. Used properly, they are considered safe and effective and are for external use only and for a short duration. Be sure to read the labels so you know the recommended dosage. If a measuring tool is provided, use it. If you have questions, check with your pharmacist or healthcare professional. Analgesics are available in a variety of forms, including tablet, capsule, liquid, drops, extended release, quick dissolve, and suppository. When you begin taking them, you should not participate in activities like driving until you know how they affect you. If you are on certain prescription medications, you should talk to your pharmacist or doctor before taking an analgesic. These include blood thinners, seizure medications, and acetaminophen-containing cold medications and phenothiazines, among others. Here are some tips. If you take analgesics on most days, tell your doctor. You may need to be monitored for side effects. Do not take more than the recommended amount or more than your health care provider tells you to take. Store them safely and securely. Keep them away from children. Check the dates on containers to see when you should throw them away. Walgreens, CVS, Rite Aid, and other large drug chains offer the widest variety of analgesics in the country. This includes familiar national brands as well as their own store brand equivalents. The store brands are as effective as the national brands and at considerably less cost to you. In fact, in the analgesic section of your favorite supermarket, drugstore, or discount store, the price difference between national brands and store brands can be substantial. Strict FDA regulations apply to both national brands and store brands, so you are assured you are getting the equivalent product when you choose the store brand. When selecting OTC drugs, many consumers are very price conscious. Easily identifiable active ingredients can help you document comparability and quality between store brands and national brands. Analgesic sales last year came to $3.6 billion in U.S. retail channels. Store brand products accounted for more than 42% of that total. That gives you a pretty good idea of how consumers rely on store brands in this category. This is Bill Brooks for Store Brands USA.